Let's turn back now to the province that is struggling most with the outbreak. Cases have continued to surge in Manitoba, and current restrictions have just been extended until Saturday. At a news conference this past hour, Premier Brian Pallister came down hard on Manitobans. He said the rate of infections in the province is a result of, quote, reckless behavior, and that not enough Manitobans have gotten a COVID-19 vaccine despite lots of availability. He also said 43% of hospital patients with the virus did not get tested before arriving at the hospital.
There's an element of personal responsibility that shouldn't escape us, but seems to be escaping some, that we need to remark upon. On Friday, of the 296 COVID patients in the hospital, 129 were only tested positive for the virus after presenting to the hospital. This includes 21 people in ICU. We continue to see unvaccinated Manitobans requiring admission to hospital and ICUs. We continue to see people who are coming to hospital very sick, presenting at hospitals very sick, who have not been tested for COVID. That means that there is a far greater risk that they are transmitting COVID to others, and variants of concern work fast. We need to change these behaviors.
The CBC's Cameron McIntosh joins us live in Winnipeg. So, Cam, Premier Pallister stressed Manitobans need to do two things: get vaccinated and get tested. What's going to be done to bring down those case numbers?
Well, you can hear the frustration in the Premier's voice today, and basically everyone in this province is getting quite frustrated and quite tired of all of this, as we've seen in other parts of the country as well. So Manitoba right now, new restrictions were put in place just before the May long weekend that effectively banned all gatherings. So you can't have people over at your house, you can't have people over on your driveway, you can't go meet your friends in the park. There's still some non-essential shopping that's being allowed here. Workplaces are remaining open. There are things like that. We haven't had a full-on stay-at-home order, but basically the province is telling people to stay at home. In fact, they use the emergency alert system on Friday to remind people to stay at home over the long weekend. So those long weekend restrictions are being extended into the next weekend. The provincial officials basically are saying, okay, we have these strong restrictions. We want to give them time. We want to see them working. Of course, this will take a week, possibly 2 weeks, to really be noticed in the COVID numbers. Now, the COVID numbers did drop a bit today, but they're basically saying that could be a blip due to the long weekend, fewer people going out getting tested, that sort of thing. No one's really looking at this as a positive sign just yet. They need to see that play out over the course of several days, of course. So, as for what's being done, well, basically, it's more of the same here in Manitoba, hoping that over time these restrictions will work. Of course, there's a lot of criticism being directed at the Premier and at the provincial government saying, listen, Manitoba simply is not doing enough right now and that it needs to do more.
When the province is at a critical point, 18 ICU patients have been sent to Ontario. The province has close to 5,000 active cases, and I think I heard Dr. Rusin say that's 69% of that is just in the last 7 days. This is a huge number that's just kind of snowballed very quickly. There's a group of doctors, Cam, that's calling for the province to implement stricter measures. What do they want to see happen?
Well, I should mention also the test positivity rate here in Winnipeg is almost 16%. So today we heard something pretty significant. Some of the leading specialists here in the province are basically coming out and saying, listen, Manitoba, we need a stay-at-home order and we needed it 2 weeks ago. The provincial government, the Premier, again, he is resisting that call, basically saying our restrictions have been tough enough that more Manitobans need to be obeying those restrictions. So he's basically calling out people that have been disobeying the restrictions. He came out with some stats today. The majority of people that are going into ICU right now are, people that have not been vaccinated. Now, many people are countering that argument, saying, well, if they could have got a vaccination appointment sooner, perhaps more of those people would have been vaccinated. So this is getting to be a really circular argument here in Manitoba, right? The Premier saying we're doing a lot, people saying we're not doing enough, and then the province coming back saying, well, people aren't obeying the orders. What is not disputable, though, is the strain this is putting on our ICUs. We heard from those doctors today. Here's one of them talking about what he's seeing in ICU right now.
ICU capacity has increased 150%. We have almost 90 patients with COVID in the ICU right now. Our regular ICU capacity for the province is 70 patients. So just COVID patients exceeds our regular capacity. These patients are critically ill. They're younger and younger. And what is tragic and what is heartbreaking for the staff, these patients suffer with their illness alone. Their families can't come into the hospital.
So, Andrew, to answer your question, what next? We don't really know. There is talk of potentially sending patients to Saskatchewan. There has been suggestion that perhaps patients may even have to be sent into North Dakota. We haven't quite hit that point yet, but that could be coming in the next few days. In the meantime, the province is watching those numbers. And again, our Chief Medical Officer, Dr. Brent Rusin, saying that nothing is off the table, but so far the province has not been willing to, I guess, pardon the pun, play the card of the stay-at-home order, officially at least.
The other thing that I thought was interesting was Dr. Rusin saying there are thousands of vaccination appointments available, saying go get vaccinated. So they're right now at least.
Yeah, and some people are taking issue with that. There are vaccination appointments available, but some of them are still a couple weeks out. We had a drive, or they opened up vaccination appointments to children over the age of 12, and a lot of those got canceled because people got confused about how to sign up for them. Parents were signing up their own names, not their children's names, that sort of thing. So there have been glitches in the vaccine rollout. So again, like I say, a circular argument, people saying, I want to get vaccinated, I can't get vaccinated quickly enough. Some, criticism today from the Premier towards some people saying, hey, listen, you got to get on this sooner. So right now, there are a lot of people in this province standing around in a circle, pointing the finger at each other, blaming one another, while we still have these basically stressed out ICUs and these high test rates and this high test positivity rate.
All right, Cam, thank you. That is the CBC's Cameron McIntosh live in Winnipeg.